The Appropriations Subcommittee on Labor, Health and Human Services, Education, and other agencies will come to order. Good morning to everybody. We're glad you're here. We want to particularly thank our witnesses for coming today to give us a chance to talk about this critical issue that confronts our country, the opioid epidemic. The crisis is the worst drug epidemic that our nation has ever faced. Current death rates of all drug overdoses rival those of the peak of the AIDS crisis in the 1990s. And opioid-specific overdoses now surpass car accidents as the #1 accidental death cause in the country. Over the last 3 years, Senator Murray and I have been the chair and the ranking member of this subcommittee. We've written bills that repeatedly increased the opioid funding, an increase of about $760 million, which is a 1,300% increase from where we were just 3 years ago. Obviously, more money needs to follow that, but this committee particularly needs your help and the help of others, the help of these witnesses and others in determining how that money can best be spent, how it can best work its way into the system, and then some other group will have to help us figure out where to find the money that we need to find for this issue. We've confronted it head on. I'm glad to see that the president is also focused on this problem. In October, President Trump declared a public health emergency, and in November, his Commission on Opioids released its final report, recommending a number of specific areas where we could focus. Included in the panel today, we have my friend from our service in the House of Representatives together, Patrick Kennedy, who was also a member of the commission. The commission's recommendations include many of the programs we have funded the last several years, as well as some really new ideas that I think our subcommittee wants to closely consider as we finalize the spending bill for the fiscal year that we're already in, but haven't yet come to a final conclusion as to how that money needs to be spent. We need to look at what programs are effective, at where we should focus future funding, and what new proposals we should consider as part of an omnibus spending bill for this year. In particular, as I hear from people in my state of Missouri, the experts of the field, including the panelists here today, think that this subcommittee needs to consider 3 key proposals moving forwards. One, the best option for treating an opioid use disorder. I believe this means recognizing that behavioral health issues should be treated like all other health issues, that mood and anxiety disorders double the risk of addiction. If you're going to effectively address opioid addiction, we need to ensure that those suffering can access effective treatment, and that needs to include mental health services. Secondly, we need to stem the number of individuals who become addicted in the first place. We need to do all we can to ensure that the people that we work for, the people of our states and of the country, understand the real and obvious risk of taking opioids and taking them in a way that can lead to addiction. Finally, simply reducing opioid prescriptions doesn't address the core problem of the crisis, effective pain management. So we need to be focusing on new pain management strategies and research strategies that help get us there. There's clearly no one silver bullet to solve this crisis, and so we have a panel today that really brings a broad base of the kinds of things that we need to be thinking about, the kinds of areas that we need to be addressing, and then to help us work through a realistic implementation strategy. 1,300% increase is a pretty big increase over 3 years, but admittedly we started at a pretty small number. So we're going to be listening carefully to what advice you have for us, and we'll have questions for you, and glad to have the President Pro Tem Emeritus of the Senate and the ranking member of the Appropriations Committee with us. And Senator Leahy, if you'd like to make some comments, that would be certainly appropriate.